You want to feed Franklin? No. All right, let's do it. Liam came into this world at 35 weeks, 2 pounds, 12 ounces. Everybody he comes into contact with, he just brings happiness to them. He's just like this miracle kid.
Hey, it's okay, buddy.
Ethan, similarly, was premature, even more so, 27 weeks, 1 pound, 6 ounces. But this time there was no beautiful cry.
He had everything go wrong that could go wrong. He was on a ventilator, and even some of the doctors didn't understand how he was even alive. Just his tiny, his fragile little body, like wondering how do you survive this?
I met the family in the NICU with their youngest child, Ethan. Because he was born very premature, he had some neurologic complications, so I became involved with taking care of him in that setting. Around the same time, Mom approached me about her older son, Liam, who was having a little tremor. And as he's waiting for his MRI to be done, he was roughhousing with his dad, falls, and has a seizure at home. And this kind of unfolded a very extensive workup of what this could be. MRIs of his brain, MRI perfusions of his brain, a spinal tap. I myself swabbed his cheek for a genetic test that eventually showed up to my email a few weeks later, confirming the diagnosis of Coates Plus.
Ethan and Liam have a rare genetic disorder called Coates Plus syndrome. It generally affects the eyes as well as the brain, the GI system, bone, and other parts of the body.
And I remember having my heart broken in a million pieces because as I'm reading the symptoms, I'm saying to myself, Ethan has this disease as well.
Its prevalence is less than 1 in 1 million people, so for 2 brothers to have it is extremely rare. Unfortunately, there's no treatment for Coates Plus syndrome. As time goes by, their genes are deteriorating. Individuals with this syndrome don't live to be past 30 years old. Everything is a symptomatic treatment. So we as a multidisciplinary team, complex care along with neurology, genetics, hematology, and gastroenterology, as well as rehab and other specialists, get together and try to find a treatment plan that's best for the family. In the case of these brothers, they're undergoing preventive infusions to help stabilize their brain lesions and undergoing routine evaluations of their liver and blood to make sure that they don't need a liver or bone marrow transplant.
It's possible that there may be cirrhosis or end-stage liver disease down the line, and so not only do we want to prevent that, but if we get to that point, which we hopefully don't, we need to think about things like even transplanting the liver.
We're trying to react to the manifestations of the disease when they arise, and then we're also take on the exhausting task of being parents to 2 special needs children. A lot comes with that.
Palliative care works specifically with families that are with chronic complex disorders that helps families potentially navigate the complexities of the healthcare system with multiple specialists, multiple providers involved in the care.
In patients that have extremely rare diseases, fortunately we are able to connect with our colleagues at Boston Children's Hospital. They provide support for these very rare syndromes.
The specialist there has a research team that's actually mapping out the specific issue that our children have. So now we're in a place where we have our researchers to help with that aspect of this.
Both boys did go up to Boston and met with hematologist oncologists up there who examined them, examined their medical records, and was able to provide some recommendations for care locally at home.
To even have that is just such a sign of hope. And we're very fortunate that Joe Dimaggio has that complex care team with that direct channel to Boston's children.
I think this case really highlights how the complex care clinic created a space for us to be able to work as a team very effectively, where we can kind of streamline some of the appointments. And it's also really helpful with communication between team members.
To have the specialists being able to organize in a fashion towards a team in a complex care and you have a head of that, that is something that these kids wouldn't have a chance without that organization. Everyone gets infectious to Dr. Early.
Focusing on their child's comfort at all times, in the hospital, outside the hospital, is key. We all want our children to be happy and thriving and not in pain, not suffering.
The compassionate nature they took towards us, to understand our situation, that care and compassion shines through with them in their treatment of us.
We can coach along the journey of life and providing different levels of support always.
My heart goes out to these families, and each child is is precious, has so much to give, and we have so much to learn from them.
I've learned from this family about their resilience, their great attitude towards this, and they are just a bright light for these children, and I commend them on what they're doing for them.
I think with us as a family, we're not going to be resigned to the fate that all the kids had before that came before us, because it gives us hope. At the very least, whoever comes from behind us that is the same situation, they're going to be left with something. They're going to have more than what we had.